So, even though you're the all-time leading assist, all-time leading steals guy, an NBA Hall of Fame player, you're pretty, you're pretty, you're not on social media pretty much.
Correct.
And, you kind of stick to yourself, and you don't go out there a lot on this stuff. And then all of a sudden you come out about this. So, I mean, for you to do that, and for the last, you've been retired how many years?
20.
You've been retired 20 years, and you've been pretty quiet, just off in the sunset. And now all of a sudden you're pretty vocal about this. So you must have a pretty big passion about this subject for you to come out against this.
I think it's the most important thing in my life.
That is incredible to say, John. That's incredible.
What else is there? I mean, I'm an old guy now. I get it. I'm not in the game anymore. I get that. But I've got kids. I've got grandkids. I've had kids suffer through the impacts of this. They say you got to get the vaccine, you lose your job. Okay, that's happened. If you don't want to do the vaccine, then you got to test 14 times a week or 20 times a week, which is not okay. None of that's okay. Then you got to wear a mask. That's not okay. Then you get quarantined. Then you get sequestered. You're treated like a second-class student. Not okay, not okay, not okay. My grandson goes to school wearing a mask, comes back. I mean, we know that a 5% loss of oxygen to a child's mind is something you don't get back. And those masks keep oxygen out. They keep the toxins in. I mean, we're supposed to eliminate, not hold it in place to breathe and breathe again. It's just not something that's okay. It's not something I can turn my head on and walk away into the sunset, as you said.
Well, and not only that, but, we were in Palm Springs one time last year, and we talked to a gal in a retail store, and she said her son was 7. And she said after they lifted the mask mandate in California, that it was the first time her son had seen his classmates' faces. That's not good.
No.
I mean, we are created to be able to see each other. I mean, and our immune systems have been created to fight viruses and fight bacteria. And there are certain times where we do need medical intervention. There is no doubt about it. But viruses are nothing new. And our bodies have been fighting for thousands of years. And even if the is a novel virus, it's still, and if it was even man-made, in my opinion, it still is going to revert back to its more natural source, and it's going to mutate. And our body's immune system has been trained for thousands of years, created very wonderfully, by the way, to be able to fight those viruses.
Right. Well, until we interfere with medicine, frankly. I feel like all medicines hurt your immune system, all of them. Now, they may help. They may solve your problem temporarily, like an antibiotic. If you have double pneumonia, that antibiotic might save your life, but it doesn't help your immune system. And you can see that on any ad on TV, these enormous 9 out of 10 ads where they say, may inhibit your ability to fight off infection. They all say it.
Yeah.
So we know this to be true. And that's what I think about the comorbidities. When the narrative comes out is, well, they died of comorbidities. I'm saying, no, maybe we got to look at they died of medication, piles and piles of these seniors in these facilities, 10, 13, 15 medications they're taking. That, I think, is where I would look first.
Well, and early on in the pandemic, when people were hospitalized, they were put on ventilators, and probably unnecessarily. And that killed a lot of them unnecessarily. And they weren't doing early treatment. And, there's a medication called, you may have heard of that.
Oh, yeah.
And I've talked to ICU nurses that used to work in the hospital, and they would infuse that, and they called it run, death is near, because they knew in about 3 days the patient was going to die. So how many patients, like you say, how many patients did our medical system really kill by giving them poor treatment instead of treating early with other interventions?
That's a little scary, and it's hard to stomach. Again, I've always had faith in the medical system, the people that do it, and I still have faith in the people. We've talked to enough doctors now, and the people that are in that environment, they see it. It's just hard to give up all that investment of all the study and being able to feed your family with what they've trained to do, to speak out. Because if they speak out, that is a death sentence. It's like for doctors.
Yeah.